Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
But what you saying, Jimmy? Means you're in a hot minute, you know. We're going to say that it's been a hot minute for real. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out there for a little bit, but still I just have some fun though. Well, my say I can't leave the house unless I'm vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better than worse.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
When you're deaf or hard of hearing, operating a vehicle presents a unique set of challenges. If you're pulled over by the police, please follow these directions. Using your left hand, hold your communication accommodation visor card outside the driver's window in plain sight for the officer to see. Indicate to the officer the best way to communicate with you. The officer will then use this method to alert you for the reason of your traffic stop and what you need to provide. Be sure to follow all the officer's instructions to ensure a safe and calm interaction. To obtain a communication accommodation visor card for drivers who are deaf or hard of hearing, please contact the Virgin Islands Bureau of Motor Vehicles at 774-4268 on St. Thomas, 713-4268 on St. Croix, or 776-6262 on St. John.
Sponsored by the Disability Rights Center of the Virgin Islands.
Good day, Virgin Islanders at home and abroad, and happy Thanksgiving week. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of November 22nd, 2021. Joining me this afternoon to share the latest COVID-19 data and information and where you can get a free COVID-19 test and vaccine this week is none other than our Health Commissioner, Justa Encarnacion. But before we go to the Commissioner, I want to tell you this afternoon, I have to extend my heartfelt condolences to the family of David Edgecombe, especially to his wife, Lenore, all his friends on his passing this past weekend. The total community is in mourning for the loss of this UVI associate professor, playwright, youth advocate, and genuine Virgin Islander. David Edgecombe has been a tremendous individual in our community, and his passing is a huge loss for all of us. His contributions to our youth through various initiatives and programs like Starfest really created an avenue for many young people in this territory and provided many the opportunity to showcase their God-given talents. His renowned prestige as a playwright throughout the Caribbean kept the U.S. Virgin Islands and our rich culture on the world stage. More so than ever, I knew David personally, and he was definitely a beautiful human being and a Class A act. And he will be sorely missed by me and the entire Virgin Islands community. So to his entire family, we just want to say we give our prayers for you in this time of sadness and bereavement, and pray that his soul will find peace and that you will find peace and solace of his great contributions to not only the Virgin Islands, but to us each individually as a friend, co-worker, and just David. Now we'll go to Commissioner Encarnacion to get the latest on our COVID-19 updates.
Good afternoon, and thank you, Governor Bryan. I too would like to extend condolences to the Edgecombe family as he and I worked together. He was a big advocate for the MOTEP and the Minority Organ Transplant Program, and I really want to extend condolences to them. Thank you, Governor, as I said. As of November 20th, 2021, a total of 218,565 tests have been conducted in the territory. Of those tests, 7,446 individuals have tested positive. The 7-day positivity rate is 2.33%, which is up from last week's 1.87%. There are currently 94 active cases in the territory, 80 on St. Croix, 12 on St. Thomas, and 2 on St. John. 7,268 cases have recovered, and unfortunately, there have been 85 fatalities. It is comforting to see that the numbers on St. Croix, St. Thomas, St. John, and Water Island District remain low. However, we should not get comfortable with the low numbers, as other jurisdictions in the mainland U.S. are experiencing COVID-19 surges, which may affect us as we have seen in the past. COVID-19 is one of the most virulent viruses that has ever existed. This brings me to family table time and the beginning of our Thanksgiving and Christmas holiday season. It's a joyous time for us, one that we celebrate with family and friends, and of course, eat good food. My ask of you this season is to discuss with your loved ones the manner in which you celebrate. It is important to limit gatherings to small groups. Wear a mask over your nose and mouth. Wash your hands frequently, and most importantly, get vaccinated to protect your family. Reminders: if you are sick or have been exposed to someone with COVID-19, please call the epidemiology hotline to schedule an appointment for COVID-19 testing. The hotline is open 7 days a week, 8 a.m. to 10 p.m., and you can call 340-712-7619 or 340-712-6299 or 340-776-1519. You can also schedule an appointment online at covid19usvi.com/testing. From our hospitals, the Governor Wang F. Louis Hospital and Medical Center reported 1 COVID-positive patient. The patient is not ventilated. However, throughout the week, JFL peaked at 5 admissions, with one of those patients eventually passing away. Condolences to the family. The Schneider Regional Medical Center reported 0 COVID-19 admissions. Everyone ages 5 and older can get vaccinated. Stay safe and help us reduce the spread of COVID-19 in our community. The Advisory Committee on Immunization Practices, or ACEP, has provided guidance and accepted by CDC. More Americans are now eligible to receive the booster shots. Everyone 18 years and older is now eligible for a booster shot. Specifically, healthy people who were not previously recommended for a booster shot may now receive one if they receive a primary mRNA, which is Pfizer or Biotech or Moderna COVID-19 vaccine series. In addition, any people 50 years and older are recommended to get a booster shot. Recommendations for Johnson & Johnson or the Janssen COVID-19 vaccine remain the same. Everyone 18 years and older who received a J&J or Janssen vaccine at least 2 months ago should get a booster today. President Biden and his staff have prioritized increasing equity and access to vaccines. In a conversation facilitated by the former Delegate to Congress, Donna Christensen, along with Dr. Marcella Nunez-Smith, who leads Biden's Health Equity Task Force, made it very clear Black, Brown, and Latinos are now the group that are leading vaccinations throughout the nation and actually throughout the world. 70% Black adults, 71% white adults, 73% Hispanic adults have now at least one shot of the vaccines. This is important progress in increasing vaccination rates and decreasing vaccination inequities. This is important progress. That's a result of intentional work to address those barriers, to address those concerns. That's the result of work done internationally, done locally. Puerto Rico has one of the highest vaccination rate per jurisdiction. The United States Virgin Islands, however, we have one of the lowest vaccination rates. That's words for thoughts for you. Ask will come, you know what we need to do. We need to vaccine, we need to increase community immunity, and we need to come out of the pandemic. This is going to be very short today. Really and truly just want to wish each and every one of you a happy Thanksgiving from the Department of Health family. I want you to be safe always. To keep up with the latest information, include COVID-19 epidemiology and vaccine data, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19.usvi.com. And for COVID-19 health information, alert text COVID-19 USVI to 888-777. Again, happy Thanksgiving and be safe. Back to you, Governor, and thank you.
Thank you, Commissioner. I just want to give a little shout out to Commissioner Encarnacion and our whole team over there at Health. Last week, we actually did the ribbon cutting on 3, not 1, not 2, but 3 behavioral health vans that are going to be going out through the community and offering assistance to people, one for St. Thomas, one for St. Croix, and there's one also for St. John. So we're going to staff those up and have them positioned at different places in the community. And we're hoping that, it's been a tough time and there's a lot of mental stress. I mean, we have a stigmatism around people thinking you're crazy or whatever, but this is about mental health. It's not only about feeling okay, but it's about feeling good inside about where you're going, what you're doing. You're comfortable, you don't have anxiety. I know we do a lot here to make sure that you have an easier time dealing with the reality of the pandemic, the recovery from the hurricane. It's a lot, but we have resources out there. So we thank the Commissioner and the Department of Health for having these vans. We also want to thank the legislature, former Senator Nelly O'Reilly Rivera, who sponsored a lot of these, and these vans are coming up on board now. We were there with Donna Gregory, our current Senate President, and some other senators there announcing that. So that's a great win for the Virgin Islands, especially in behavioral health We do have a piece of legislation that we're working on with the legislature, and hopefully that'll help to ease some of the mental illness in our community. Speaking of health, we also graduated 8 firefighters EMR last week. And I say firefighter EMR because these new 8 firefighters are trained in emergency response. And one of them is actually working on becoming a full paramedic. It's just the Virgin Islands is a little bit safer now as we get more and more firefighters trained to respond to incidents in our community. It's our goal that we will have people that can give immediate action in every single fire station when something happens. So by the time the ambulance gets there, you or your loved one is stabilized. So that legislation is also pending. We want to encourage the community to support us in getting this done. After we've been trying to do this for at least 12 years now, and we already have ambulances in some of the firehouses. So we're looking forward to getting this legislated and finally done. Not for us, but for the entire community. This month, More Health Again, is the month of November is National Diabetes Awareness Month. As many of you know, diabetes awareness is something rather near to my family's heart and an important issue in the territory to which we could use more advocacy. And additional healthcare specialists are needed as well in this regard. But I'm happy to share with you that this afternoon, that next week, we'll be announcing a public-private partnership that will bring added healthcare specialists and clinical care to individuals with diabetes in the territory, and also increase educational outreach, support services, and the like for diabetes patients, their families, and members. Also be sure to catch the First Lady, Yolanda Bryan, and our daughter, Aliyah, on the press box. That's this Wednesday at 5:30 p.m. to share our family's personal experience with diabetes and to raise awareness for National Diabetes Awareness Month. I know this is something that most of us have in our families, people who suffer from diabetes, either type 1 or type 2. We've been dealing with it in our family since Aliyah is 12. She's like 24, 25 now. And it's daily, and it never goes away. There are a lot of issues, people aging out of health insurance at 26 and trying to find work in that regard. There are other issues in terms of there are no pediatric doctors down here that deal with diabetes, pediatric endocrinologists. That's a real challenge and has been for our family. There's new upgrades and stuff that have been, well, they're not new, they've been around for a long time, like the pump and auto check for diabetes. So we just want to get people the most care so we don't have to be caring for them in dialysis or other foot care and other things that can happen if you don't take care of this disease. So we're trying to do as much to bring awareness around it. You know, people with diabetes are also prone to coronavirus, severe illness, and death. It has really been a scary time for those of us who have loved ones in our family with diabetes, and we're glad to see the vaccine come along. But the vaccine is not enough. You still got to take care of your body, exercise, eat right, and get out there, check your sugar. So just letting you know what's going on. We're going to be doing more about that and trying to get people healthy. Speaking about not healthy, it's Thanksgiving week. And as we get ready to celebrate, we know you got a macaroni and cheese ready. We know that as you get ready to celebrate with your loved ones this Thursday, I want to ask all of you to remember those families here at home with one less seat at their Thanksgiving table. You know, one of the things about COVID is there are a lot of people who passed away in the last year and a half. And it's not from COVID alone. It's just that we've been inside. So it's only when you see somebody's family and you miss them and you ask them, like, for the person to be like, this person passed away, whether in the States or here at home, you just don't go to as many funerals. You know, funerals is a big part of our culture here in the Virgin Islands, and what we do, we share and show up for people when they have a loss in their family, whether they're a friend, a mother of a friend, whatever, we show up. So there are a lot of people who have one less seat at their Thanksgiving table and at their Christmas table, their holidays. Some of it, like I said, is due to COVID-19, but all kinds of things happen every day to good people. I want to encourage all of you to take a little time this week or on Thanksgiving to perform an act of kindness. Extend like a little helping hand to someone in need. Call a family member or friend whose Thanksgiving this year may not be the same as it was before the pandemic started. Volunteer a couple of hours to a charity or community group. For one, the Catholic charities, that's where I'm going to spend a little bit of my time. Actually season and cook my first turkey. Yes, it's going to be good. The Catholic charities, they're still looking for donations on St. Croix. If you want to cook a turkey or a ham, or they said they need some side orders, 2 macaroni and cheese, rice, that kind of thing. You could drop it off at St. Mary's on Thanksgiving morning at 8 a.m. For more information on that, you could call Andre McBean, who was in St. Croix, no Andre, 340-643-0257. That's 643-0257. You know the area code, 643-0257. For more info. And thanks, Andre, Luther, and those people for doing this for our community and organizing that. But there are several other charities here. I know my lodge is going to be giving out some turkeys. Jason and Avery been all weekend long giving out turkeys with our police, different other people in the community. So it's good. You know, you just drop off a turkey or a ham to somebody, let them smile a little bit, or some macaroni and cheese. This is one time it's okay to slugs. As a community, though, there's a lot that we really have to be thankful for. Going around and being able to talk to different leaders in the Caribbean and in the United States, it's really good to be in the place we are, considering the pandemic and all we've been through. I am eternally thankful. I was in St. Andrews this weekend with Father KB. Big hail up to Father KB and the St. Andrews family. And just wanted to say thank you to the community. And there's not enough of you in church while I got your attention. So, you know, let's start going back to church. You could wear a mask, sit in the pew, make your contributions. I'm saying that on behalf of all the pastors. I was kind of shocked to see that there wasn't as many people in the pews. So wherever you go to worship, church, synagogue, wherever you go, temple, try to go there within the next week or two, and let's get stuff back to normal as much as possible. I want to also talk about and extend a special thank to all the volunteers who pitched in to assist with building the new and improved Midre Cummings Park in Frederickstead. You know that Midre Cummings actually showed up and nobody knew who he was. He worked a whole night and then he came back and he worked another night, and when he mentioned it to the commissioner, and the commissioner, he was like, "You don't know who I am?" And he's like, "No." He says, "I'm Midre Cummings." So thank you, Midre, for making it home and helping with the park. And a real heartfelt thanks to the entire Virgin Islands community, because we had people come, St. Thomas, St. John, flew over to help with the park. That park is now almost complete, but complete enough where kids could play on it. We have some other things to do to enhance the park, including redoing the fence. Senate President, I need some money for that, so let's appropriate some money for the new fence over in Midre Cummings Park. I was there last week. It was just incredible to see the community working to that in that way together to support our young people. Now, it wasn't finished yet, but I was on Facebook looking, it looks awesome. And then we redid the basketball and tennis courts next door, so it's complementary in the nice blue and aqua blue colors, aquamarine colors. It's fantastic now. But I think it's a trophy to our children, and it's a firm statement about what we can do as a community when we put our heads together, when we all row the boat in the same direction, and when we're intent on getting it done. In 10 days, they put that together. Of course, it took a lot of organizing. I thank all of the organizers, including Brian O'Reilly and all of the people, Claire, everybody who pitched in. I know we had some little friction along the way, but in the end, what counts is the impact and what you see there today. So whether you came from La Grange or as far as Chocolate Hole in St. John, thank you for contributing. Just as a reminder, not that any of the government workers need a reminding, that this week our offices will be closed on Thursday as well as Friday. All non-essential government employees are off. Having said that, Friday's a day of really reflection. We did it last year, and I want people to really just spend some time, just being grateful and thinking about what they have and where we are in the world and what we could do to help other people as we go into this holiday season. We're slowly creeping, trying to get back to normal, but certainly we are still in a pandemic, and the fourth surge in Europe is definitely graying my hair a little bit more. We got our eyes on it. But we have a lot, and we have a lot to be thankful for. We don't have everything, no one does, but we have a lot to be thankful for. So I guess I'll wrap up now and take any questions from the press. I think we got St. Croix Avis there. Is that La Ciba? Okay, I'm not hearing from La Ciba or St. Croix Avis. Ernest
Can you hear
Gilbert?
me, Governor?
I can hear you now. Go ahead.
Oh, okay, yes. This is Kay with the Avis.
Hi, Kay.
Hi, yes. And so we were wondering if we could have your reaction to the sale of Lime Tree Bay Refinery. And if we could we also ask how your administration plans to work towards a solution with the EPA, given the regulatory concerns they have recently expressed?
Well, I mean, on the sale, I'm pretty happy that local people own it now. I mean, I know these guys who make up St. Croix Energy. I'm pretty proud about that fact. However, I am a little concerned, I must say, about the resources needed to get it up and in operations. I think I have a meeting with them later this week. As far as the EPA, we meet with Ms. McCabe tomorrow, who is the Deputy Director under EPA, to talk a little bit about that as well as some other issues we have. We're going to be giving 190% of our effort to get this moved through the EPA safely. We want to see the restart of the refinery. It's a priority of my administration, but we want to do so in a safe manner. We don't want to have the kind of things that we had before with residents experiencing smells or sprays or any kind of residue coming off the refinery. So just a little concern in terms of the money it's going to take in order to get it up and going. But they have our full support, and they have our full support in terms of getting this EPA agreement signed.
Okay, well, thank you.
Thank you, Kay. Ernest? Ernest, you on mute? Daily News?
Hi, this is Sarah Kirkpatrick with the Daily News.
Hi, Sarah.
I had a question for the health commissioner. You were talking about the differences in vaccination rates with Puerto Rico and the Virgin Islands. And I mean, they are pretty similar in terms of they're both territories of the U.S. Do you have any ideas on maybe why we have a difference in the vaccination rates between the two territories?
They're bringing up the commissioner. They wanted to...
Can you hear me?
Yeah.
Okay, good. Thank you. So the jurisdictions are a bit different. The demographics is somewhat different from Puerto Rico to the USVI. Our vaccination rate per se or percentage, not just for COVID, but for childhood vaccines, have always been a little low. So to answer the question why, we have been actually asking that same question. When we ask, simply individuals indicate just because we don't want to at this point in time. It's not because they're waiting for full approval, because full approval has already been given. I have to say that Puerto Rico did put in a little bit more stringent requirements or guidelines going into restaurants and doing a little bit more in reference to mitigation, but we haven't. And it's not because we can't, but we really prefer for it to be a decision made by that individual. So not many mandates have been put in place. However, the ask is there. It's important for us to become immune, to get community immunity, and to be able to really reach that herd immunity that we need so much to get out of COVID.
Great, thank you so much.
To the commissioner's comment, which she's spot on. We haven't made it mandatory for all government workers. We haven't made it mandatory for restaurants. We've really taken the position from an administration that it should be choice. And I always said that if our numbers in terms of infections keep showing us that this is what we need to do, then I will do it. But as far as I'm concerned, I really think it's a person's personal choice whether they want to take the vaccine or not. And I realized it was driving a rift in our community by putting the people who are vaccinated against the people who are not vaccinated. And that's just not good. We should encourage people. We should incentivize people. But if they don't want to take the vaccine, they're on their own. At the same time, up to today, I was listening to somebody who was saying, well, if you're vaccinated or unvaccinated, you can still catch COVID. And I've said this 100 times. Catching COVID ain't a problem, dying from COVID is a problem. And what we worry about most is not people getting the virus. People are going to get the virus. It's the resources at the hospital. It's burning out our nurses, our emergency room, our intensive care personnel. That's the concern. And it should be a concern for everyone because we have COVID now. You know how many people have died alone in our hospitals because we can't, not only here, worldwide, because you can't come in the hospital to visit because of the COVID restrictions. You know how many people have died because hospitals, not here in the States, have been full, and because they had a non-COVID problem, couldn't get medical attention because the staff is exhausted dealing with COVID patients. Excuse me, or for that matter, being able to get a bed. Medical attention and medical resources have been strained to the max. We've been fortunate here in the Virgin Islands that we're able to pay through the nose, I might add, to get medical personnel to assist our nurses. And we are actually losing our nurses. We have an incentive plan that we agreed on with the hospital. We're funding that. That should be coming up soon. So nurses, if you're out there thinking about another job, hold on a little bit. We got something coming your way. Ernest, you there yet? Okay, expect rain today. The consortium doesn't have any questions.
Governor, can you hear me? Governor, can you hear me?
Yeah, I can hear you, Commissioner.
Okay, good. Thank you. I wanted to add something to that. The conversation we had with Dr. Nunes-Smith brought light to a lot of different things. And one of the questions that was asked was, are we going to ever be rid of COVID? And we spoke about the fact that we will in time, but some pandemics, endemics took up to 5 years to really reduce the number of individuals who were contracting or transmitting the virus. Well, one of the questions individuals ask all the time is, why should I become vaccinated if when I get COVID, I build that immunity? Well, you said it, Governor. If you are not vaccinated and you acquire COVID-19, especially from someone who have not been vaccinated and their viral load is very high, the possibility of you becoming very ill is there. And so yes, a vaccinated person can become or transmit COVID to another vaccinated person, but the immunity are higher and the viral load is going to be lower. So the illness is going to be lower. So it really and truly comes down to putting the science together and making the best decision for you. One of the other conversations is long-term effect from COVID-19. Some individuals experience it from a short period of time, some up to a year, and some actually develop chronic illnesses as a result of COVID-19. So those are all the things that you need to consider when considering whether or not you should become vaccinated.
Yeah, that's a good point, Commissioner. A lot of people, while they didn't die, they became severely ill and need extreme lung therapy. Some people are in rehab centers. A lot of people who just got really ill. I mean, your body could take so much, so it's going to affect them for the rest of their lives. So get your vaccine. I'm encouraging you once again to go out there and get vaccinated. You do yourself and your family a favor. That's it, I guess. Have a safe and blessed Thanksgiving. Give thanks this week and give somebody a turkey, a ham, or just a hand. And stay safe, stay sanitized. This governor loves you.